Welcome back. In this video, we are going to discuss about a homeopathic remedy called KALMIA latifolia. The common name of KALMIA is mountain laurel. KALMIA is an important remedy for rheumatism. It is especially suited to people of rheumatic and gouty disease. And these people having this rheumatic and gouty disease also have a tendency to metastasis. What is metastasis? The cancerous conditions. Who is the prover of KALMIA? It is Dr. Herring. Let us look at the sphere of action of KALMIA. KALMIA shows a prominent action on the heart. First comes the heart. The prominent action is seen on the heart, the blood circulation, and we have the nerves, joints, and also on the skin. First, let us understand the guiding symptoms of the remedy and then move on to the particulars in each section. KALMIA is adapted to rheumatic and gouty complaints. When heart is involved as a consequence of these rheumatism or gout. So guys, what are they saying? First, the patient experiences rheumatism or he comes up with the complaint of gout, and because of these complaints the consequence, the result of the rheumatism leads to heart affections in KALMIA. You getting it? So let us see the gout and the rheumatism. The picture what they've given here, this is rheumatoid arthritis picture, where you can see the deformities in the terminal phalanges, and this is the gout where the big toe of the foot is being involved. Now here you can see there is atherosclerosis. So they are saying how now you might wonder, now this is a joint affection. Rheumatism is a joint affection. How is it affecting the heart? So you can see there will be atherosclerosis. This atherosclerosis leads to thrombosis. Thrombosis, the clot can get obstruct the artery of the heart and it can lead to the heart failure. So heart affection as a result of rheumatic affections. Okay. Gout versus rheumatoid arthritis symptoms. So you can see here the gout, the patient comes up with the body being affected on one side, whereas rheumatoid arthritis, it can affect both the sides. It will start in big toe. Rheumatoid arthritis problems more it is seen in the early morning. Uric acid crystals will create the bumps around the joints, whereas here the fever can also be seen in gout and it flares up at night and remission periods can be there. Here it is improve with the gentle movements, but symptoms will worsen over the time. So you can see early morning aggravation, and after some time the patient's he feels improved with the gentle movements. And then we also have fatigue here. I just want you to know, just now when you're studying KALMIA and gout versus rheumatism, now when you're writing your exams or you'll remember it, okay, gout, the big toe is affected, and then in rheumatism, both terminal phalanges are affected, terminal and all joints are affected, and then you see the complaints will be worst in the morning in rheumatism. Here you see that typically the big toe is affected. For now by this time you know KALMIA for rheumatism, for gout, and as a result of these conditions, as a consequence of all these, the heart at the end is going to be affected. Now let us look at the pains in case of KALMIA. There is sticking pain, darting, pressing, shooting pain, which is in a downward direction. So guys, you can see here how is the direction of the pain. It is in the downward direction. So you can see all the pains here, they are going in a downward direction. Here also it is going in a downward direction. And sticking, darting, pressing, shooting type of pain. The pain is attended or it is succeeded by a numbness of the affected part. So along with the pain, we get to see numbness. Okay, there is pain plus numbness. Neuralgia, the pain is shooting downwards with numbness. fulgurating pains of locomotor ataxia. Okay, these are the specific type of pains. Heart complaints are developing along with, or they are alternating with the rheumatism. So you can see here, guys, as a result of, okay, either because of the rheumatism, the result of rheumatism, the heart is affected, or there will be rheumatic complaints alternating with the heart complaints. Heart and rheumatism, or rheumatism and heart, they are going to alternate with each other. Moving on, rheumatism, the joints are going to be hot, red, swollen and painful. Now you can see the joint here. How is it? Hot, red, painful and swollen. There is shifting type of pain which goes from one joint to the another joint suddenly. So you can see here, there can be the pain can be in the shoulder. Suddenly it goes to the hips and then suddenly to the knees. The pains are shifting type of pain which is going suddenly from one joint to the other joint. Getting it? Okay. The pulse is slow, it is scarcely perceptible, that is 35 to 40 per minute. So usually the pulse will be 70 to 72 per minute. Here it is half of it, there is just 35 to 40 per minute. There is pale face and cold extremities. So you can see the pulse is very slow, scarcely perceptible, cold extremities, pale face. Moving on to the next guiding symptoms, we have vertigo. Vertigo when the patient is, especially when he is looking down or he's stooping. Same type of vertigo is when the patient is stooping or looking down is also seen in spigelia. Moving on to the particular symptoms, let us start with the eyes. KALMIA is useful in neuralgia and also in rheumatic pain in the eyes and eyeballs. So guys, you see here more of the nerves. We saw the sphere of action. So a sphere of action, what it is doing on the nerves, acting on the nerves, KALMIA is producing the neuralgia. Acting on the joints, it is producing the rheumatic pain. It is also seen in the eyes and the eyeball. There is stiff drawing sensation. You can see the eyes are very painful. There is a stiff drawing sensation, like the pulling drawing sensation in the eyes when they are just trying to move the eyeballs or the eyes. There is a stitching pain, especially in the right eye. You can see the right eye is being affected here, and there is a stiffness of muscles along with the there is pain along in the orbits, and also the muscles are going to be stiff. In rheumatoid arthritis, we also get to see the rheumatic iritis, scleritis, and we also have an impairment of the vision because of these rheumatic iritis and scleritis. So guys, as a conclusion, what you have to remember in the eye complaints of KALMIA is it produces neuralgic pain in the eye, there is stiff sensation when moving the eyes, stitching pain in the right eye, stiffness of muscles are seen, and rheumatic iritis, scleritis is very important. Moving on to the neuralgic pains, it is a great remedy for prosopalgia, especially when the right side is affected. So we saw it's more of a right sided remedy. In the eyes, the right eye was affected. There was pain in the orbital muscle orbit and also the muscles of the eye. Here you can see they are talking about prosopalgia, where the trigeminal nerve will be affected and there will be a neuralgic pain in the face, and especially the neuralgic pain is seen on the right side. The pain is starting especially after the exposure to the cold, and it is extending over the head, ear, face, and then goes down into the arm. So I guess if I show you with a picture, it would be much better. So this is the face, this is the arm. Okay, so how is the pain starting? The pain is starting now. There is an exposure to the cold. So this Kalmia patient got exposed to cold. Because of this cold exposure, the pain starts from the head and it goes to the ear, and from the head it goes to the ear, and then it goes down to the face and then going to the arm. Getting it, guys? Head, face, ear, and then down the arm. The pain is attended or it is succeeded with numbness. As we have discussed earlier, the pain usually goes downwards from the face, it is running down into the arms, and then we also see the pain is always associated with numbness and kalmia. The modalities of KALMIA, this aggravation of the complaints is seen when the patient is lying on the right side or the right side is totally affected, and also on exposure to cold or catching hold of a cold from sunrise to sunset. It is ameliorated by eating. Kalmia, amelioration by eating. These are the general, not the general, these are the modalities for the neuralgic pains. Moving on to the rheumatism, again the causation is because of the exposure to the chill. The location, obviously, guys, by now you know the right side will be affected. There is numbness, coldness, weakness in the limbs. So you can see there will be numbness, coldness, and also the weakness of the limbs can also be seen. The pains are stitching, darting, pressing, and which direction? They are moving in a downward direction, accompanied with numbness. There is going to be a severe pain in the joints which suddenly shifts from one joint to other, and they are red, hot, painful, and swollen. So we have discussed this in the guiding symptoms. Now this is a kind of a revision for you, a perfection that rheumatic complaints you have to be thorough by now. Moving on to the heart, you know one point very clearly, that the consequence of rheumatism is the heart affection. This remedy is suited to heart troubles that are developed from rheumatism, and it is a consequence or a sequel of rheumatism or gout. The heart action is tumultuous. So you can see it, the rapid, okay, the increased sound can be seen. It is beating very fast, rapid, and feeble. There is very sharp pain in the heart, which takes away the breath with the extreme dyspnea and anguish. So guys, you can see that sharp pain which the Kalmia patient feels in his heart. That severe sharp pain is taking away his breath. There is lots of breathlessness and anxiety, anguish is seen, and the pain, obviously it's shooting downwards from the heart, it shoots down into the abdomen and the stomach. Getting it? The palpitations are worst when they are leaning forward. So we saw that complaints, the vertigo was also aggravated when the patient was stooping. Similarly, palpitation is also aggravated by leaning forward. The pulse is slow, scarcely perceptible, pale face, cold extremities. Moving on to the sleep, the patient is sleepless. He wakes very early in the morning. So you can see those complaints wakes the patient very early in the morning, and then he cannot go to the bed. He is sleepless. Okay. Female complaints of Kalmia, starting with the menses, they appear either too early or the menses are going to be suppressed. Either they appear early or they do not appear at all. There is pain in the limbs, in the back, and also in the inner side of the thighs. You can see in the pain in the back, in the limbs, and also the inner side of the thigh, there is going to be pain during the menses. The leukorrhea is following the menses. Moving on to the urinary complaints of Kalmia, there is a sharp pain in the lumbar region, and post-scarlatinal nephritis can also be seen. So you can see the lumbar region being affected here. Moving on to the stomach, there is warm glowing sensation in the epigastrium. There is nausea, there is vomiting, and also pain which is felt in the pit of the stomach. So guys, you can see here we do not have much important particulars. You have to focus more on the heart affections, rheumatism of kalmia. That's the main center of action, and also the neuralgic complaints. And also these you have to know: there is nausea, vomiting, and it is worse by bending forward, and relief by sitting erect, and also the complaints are ameliorated by eating. Bilious attack along with the nausea, vertigo, headache. There is sensation as if something is being pressed under the epigastrium. So guys, you can see here the epigastric region, and here in this epigastric region the patient feels something is being pressed from within the stomach in the epigastric region. Okay, moving on to the general modalities of kalmia. So by now I want you guys to guess. Without saying, you have to be able to tell by now. That's leaning forward, looking downward, open air, becoming cold, exposure to the cold, with the sunrise to sunset. So with the sun the patient has aggravation, open air, and also when they catch cold. Amelioration: eating, continuous eating, and also the continuous motion is going to ameliorate the complaints. Thank you. With this, we come to an end of the homeopathic remedy Kalmia. And if you have any doubts, please put it in the comment section. And if you like my video, hit the like button and subscribe.